Tips for new grads that I wish someone would have told me, part I lost track. It is okay to not know the answer to a question that a patient asks you. It's okay to not know the answer to a question that anybody asks you. I remember when I started my first nursing job how it would send me into a full-blown panic if a patient asked me a question about a med, a test, or a scan that I didn't know the answer to. I would scramble to pull something out of my ass using the foggy little bits and pieces of memory I had left from nursing school, and I was usually wrong. And with all of the off-label uses there are these days, you could know the answer to the question and still be wrong. But that's still okay. I remember one of my very first shifts off of orientation, I had a 28-year-old patient who was getting memantine/Namenda, whatever you want to call it. As I was listing off the meds I was giving him, he asked me what the Namenda was for, and I was confused because I knew what the Namenda was for. Namenda is used in dementia patients, so I asked him, "Do you have dementia?" And he was just as confused as I was. I remember thinking, I must be wrong, I must be confusing it with a different med because this 28-year-old clearly doesn't have dementia, unless he forgot he had dementia. No, just kidding. But I ended up looking it up on Lexicomp, and lo and behold, it's a dementia med. So now I'm extra confused. Clearly I was unaware at the time, but turns out Namenda has a laundry list of off-label uses like Huntington's, Parkinson's, ADHD, OCD, lupus, MS, nerve pain, the list goes on. But there was no way that I could have known that because they didn't teach it to us, and I was a brandy new nurse. But to get back to my point, you are not expected to know everything straight out of school, and in fact, you're not even expected to know most things straight out of school because such a huge portion of nursing is learned on the job. So if a patient asks you a question that you don't know the answer to, it is okay to say, "I don't know, but let me go find out for you." Or, "You know what? That med has a few different uses. Let me go look into your chart a little bit further to find out why we're using it for you." And never let anyone make you feel bad about not knowing something because it is so much better to admit you don't know something and to ask questions rather than pulling something out of your butt and being wrong about it. And patients have Google too, so it doesn't take long for them to find out you have no idea what you're talking about.